morning, everyone. Very happy to be part of this IC. So today I'll be talking on transition from wet lab to simulators to complex surgeries. So why is wet lab training so important? So we all know ophthalmic surgeries require high precision, meticulousness, and fine motor skills. We need extremely good hand-eye coordination and adaptation to microscope. And a fundamental component of residency is undergoing a structured surgical training. So, apart from that, it is also essential to ensure patient safety and good quality results without compromising the resident's training. So, the process of perfecting a skill is such as swimming. Starts with initial basic skill transfer and then analytical skill development and then jumping into real life situations. So, similarly, for surgery as well, we need initial good hand holding by a mentor, practice and skill development, and then facing real life situations. So, apart from this, wet lab also helps in getting comfortable with your microscope so we don't waste much time in adjusting the microscope, getting to know your IPD and getting comfortable with that, working on the correct posture and ergonomics, getting to be ambidextrous, adjusting your foot switch position so you don't waste time in the OT, and also your fine focus adjustments. So when we look at surgical training, the various options we have is wet lab, either with a cadaveric eye, human eye, or animal eye model, or synthetic eye. We also have skills lab with simulation model or virtual reality, and of course advanced mentoring with tele-mentoring or AI. So, how to set up a wet lab? This is a very nice paper published in IJO during the COVID time, where they spoke about the basic requirements for setting up a wet lab. So, your wet lab should ideally be in within the main hospital with easy access for residents. It should be a 10 by 10 feet space, which can accommodate two people, the resident and the trainer, along with the microscope, the phaco machine, and other basic requirements. So, when we talk about the tissue for practice, we can either start with human eyes, which are unfit for transplantation. That will be ideal for size and the tissue consistency. But of course, the drawback is the availability of tissue. The other option is goat's eye, which is easily available from the butcher, and it's also cost effective. But the drawback will be it's a larger eyeball with a increased lens thickness. So how do we fix the eye or mount the tissue? So we can either fashion something like this, a simple medical sample container where a aperture is made in the center, just small enough to hold the eye, and you can stuff the box with cotton so the tissue is retained well. Alternatively, we can invest in something like this. This is an eye stand, which is designed by Madhu Surgicals, which will very useful to mount the tissue. So another very interesting device which was designed by Aravind Eye Hospital is called the SAFE apparatus, the spring action apparatus for fixation of eyeball. So they have taken a hollow cylinder with one hole, and they have fitted a spring action syringe inside. So once your tissue is mounted, you just have to pull out the vacuum, and because of the suction action, the tissue is retained very well. So it's very easy to it gives good stability for the tissue during practice. We also have synthetic eye models such as this. So this is a phaco eye, again designed by Madhu Surgicals, and this is also very cost effective. It costs about 1,400 for 10 eyes, so we can practice all steps of phaco emulsification. We also have the Kitaro sets, which are manufactured in Japan. So in this, we can again do all the steps of the surgery. This is an example of the rexis in the Kitaro eye model. So this is something like gelatin paper, which we can fashion a cystitome and practice the rexis at ease. So another very interesting way of wet lab training is the surgical simulator. So I'll be showing you a video of the Help Me See simulator. So in this is a virtual reality device where it has motion sensors, and with your tactile feedback, you'll be able to do all the steps of the surgery. This is a step of the nucleus cracking, phaco 2, and irrigation aspiration, and you can also implant the IOL. So it's a very good device to again refine our cognitive skills and the psychomotor skills which are involved for a good surgery. So all this is great if we have access to it, but what if we don't have access? So this is something that we do at Ramchandra Medical College, which is your smartphone wet lab. So you just need to have the basic surgical instruments. You can place your smartphone with the flash switched on at a comfortable working distance. Increase the magnification. So your camera is the eyepiece, and your screen is what you have to look at. And with your magnification increased, you can have very good visibility of the surgical field. The only drawback is that you will not have good stereopsis with this when you compare it to a microscope. So this is a video of our resident practicing suturing on the thermocol. We can also practice the SICS tunnel. So we need to take a table tennis ball and place it on a container, and stick the thermocol which comes with our suture material. And once this is done, you can just fashion your tunnel very comfortably. And the reason for using this ball is because it gives you the contour of the sclera. So it's very similar to tunneling in a patient as well. We can also practice rexes in a tomato. This is a microwave tomato, and you can mark out the rexes so it's easy to do. And this a stapler pin will also act as a guide as a paracentesis, so you have to go through that incision. So all of this is done with a smartphone. This is a video of a resident practicing iris hooks insertion. So for this, there was no fancy equipment required. We just used our smartphone with our flashlight on. So apart from all this that I have shown, a very important vital part of learning in today's world is from online resources. We have so many of these wonderful pages with all of our mentors who are uploading content consistently, and they are showing the steps of all surgeries. And especially most of these channels focus on phaco for beginners, so it's very important, and it makes it very easy for us to watch these shows and refine our skills. So I like to end with a very famous quote by Benjamin Franklin: "Tell me and I forget, teach me and I may remember, involve me and I learn." Thank you.
Thank you, Gayatri, for that innovative talk. And a lot of surgical training starts at the wet lab. The importance of all the equipment that